Hi, welcome to my channel, the CNA Ninjas. Yeah, the ninjas over there asleep. Anyways, I'm here to talk to you guys today about getting to know your patients just a little bit. I'm not saying to get their email address and their phone number, but just get to know them because over the years that I've known that a lot of times these patients they just have us or they have family that's out of town or stuff like that, and we're the only ones that they have. So I'm just saying that when you're in there taking your vitals, I know it's a little early so they might not be that much awake, but just I always ask my patient, hey, do you drink coffee? And you should see them light up, like, yeah, yeah, I drink coffee. And I always tell them after I do vitals, I'll get you some coffee. And, when you take the coffee back to them, you might talk to them a little bit, you always have just a little bit of time, just ask them, hey, how you doing? Where you from? Or, they'll kind of talk to you and ask you stuff and you just kind of listen, and don't, sometimes they'll, I mean, not that early in the morning. I'm just saying throughout the day, get to know your patients. The more you know them, the easier it is to get. They're going to be able to talk to you about either whether it's pain or whether it's the sadness or they're missing somebody or something's going on, with them. Um, I know because once you get to know them a little bit, uh, even if it's just a handshake or, I always say, kind of know what your veterans are. I would say, are you a veteran? And they'll be like, yeah, I'm a veteran. I would say, thank you so much, and I appreciate it. And, what did you do? If they want to talk about it, they'll talk. And just to get to know them a little bit, and sometimes when you get to know them a little bit, it really shows that you care. And when they see that you care, they'll open up, they'll go to therapy, they'll be happier about it, just happier about everything, about life. A lot of times they're going through something and they're sick and they don't want to, go through therapy or they don't want to do this or that. I had a older gentleman, about 90 some years old, and he didn't want to do therapy. He didn't want to do anything. He was like, I want to go home, but I kept telling him the only way you're gonna go home is, if you get better, you got to be able to get up and he could almost stand up, but he just needed some help. He needed to go to therapy. So, every day I would tell him, no, just go. And then I found out that he was married and, his wife would come and visit him. And I said, that's the reason right there that you have is for her to get better for her, just, and I gave him a hug, and we hugged. And, you don't have to, if you don't feel like comfortable giving people hugs, that's okay. You know, um, touch them on the shoulder, say, hey, everything's going to be all right, um, empathy comes a long way in this business, and love. If you have love and empathy, man, you're gonna go a long way in this business because that's what it takes to help these people get better is love, empathy, and everything else in between. Um, I had this veteran, and let me read you his letter that he wrote to me one time. And he was feeling real lonely, and he knew that, that I listened to him and everything. So he wrote a letter, and he left it there, and he went to therapy. And let me tell you what he said. He says, to anyone who really cares about me, I have suffered a lot at my age, 68. It is time for it to stop. I've been here 2 weeks. I'm not sick from pneumonia. My payday is Friday morning. I want to be discharged. I have family to watch out for me if they had to. I want to be alone for a while. P.S. No one knows how it feels to be me. R.I.P. Tom, his last name. And on the left it says, from Lieutenant ZZ, U.S. Army, Steve. So with that being said, what does that sound to you? That sounds to me that someone that's really, really lonely. When I read that, I started crying. I mean, I just didn't know how to, I wanted to give him a big old hug, but he wasn't there. But with that being said, a lot of people are going through stuff like that where they feel like people have forgotten them, that, that they're just here at this home or this halfway, wherever they're at, the rehab place that they're at. And they just want someone to talk to, and to tell you the truth, they just want someone to love them, show love. And I do that for them, and whatever love you have in you, I know you people are younger, so you got a long way to go, and especially if you're going to become nurses, this is a good stepping stool for you to see what it's all about, and when this is the front line, like, you're in the front lines right now, and don't ever be afraid to ask for help, or even if you get emotional, go talk to your other friend, your other friends, or your coworkers. I'm not going to say they're your friends, but they're your coworkers. Go talk to your coworkers. And, I've always had a coworker to talk to, that we were close, and one way or another, that, we understood each other, and they had the same idea as I did, the same philosophy, about just getting people better. And if you just have the heart, the empathy, and all that, and get to know your patients, they'll open up to you. They'll get better faster, and everything like that. And on that note, on that story about that old man and his wife, finish up on that. Anyways, he ended up striving. He ended up leaving, getting better, just enough to go home and everything. And I kind of forgot. I didn't forget about him, but you've got a lot of patience and everything. So, a couple months after he left, and I always tell my patients, "Hey, come and visit me, but don't come back. I want you to be walking, or at least in a wheelchair." Um, and someone told me that somebody was looking for me. Somebody was looking for me. I'm like, "Well, who's looking for me?" I look down the hallway, and it's my little old man friend. And he's walking with the walker. He's not in a wheelchair. He's walking with the walker. And he said he didn't want to come until he could walk and see me. And both him and his wife came up to me, and it was one of the best moments of probably my CNA career, is when I seen him and they walked to my station to me, and and she was like, "Thank you, Thomas. He told me what you did for him, that you made him go to therapy for me, and for that I want to thank you, because now he's doing so much better." And he thanked me. He said, "Thank you, Thomas, for pushing me. I couldn't have done it without," just stuff like that. That that feeling made up for everything in the whole world that I felt bad about at that moment. It was cured. My heart was just, oh man, you'll know the feeling, because if you're in this position, in this line of work, you're gonna have quite a few of those in your heart. And with that being said, I just wanted to tell you guys thank you for all the subscriptions and the likes and the comments and everything. I appreciate it. I need that right now to get my channel. People know my theory and everything, that I want to spread my love and everything. Thank you so much for subscribing and hitting that like button, and hit the bell for me too, and spread the word for me. And with that being said, I love you guys all. Thank you so much for everything you guys do, and have a great day and a great night. Thank you so much.